Hi, good evening, Himanish.
Sir, good evening, sir. First of all, I would like to thank you for giving this opportunity. People, we have a CEO of Rice Trainings Group, Mr. Kiran Kumar CH. Let me communicate with him. We know both of us from past 5 years, um, and you have given me good suggestions before joining into R&D. Um, and sir, the first question to you is, tell me about yourself.
Thank you, Himanish. I am always privileged to help my juniors and upcoming healthcare IT professionals. Just to share on a PPT note, this is my vast experience, Himanish. As you know, I have done my graduation in Sri Padma School of Pharmacy, Tirupati in 2006, exactly 17 years ago. After that, I have pursued my master's in Annamalai University, uh, Chidambaram. Then I have done my professional diploma in clinical research. And this is my whole experience, Himanish. Yeah, I've started my career with the Tech Mahindra in 2008. And in 2011, I have moved to Bayer Clinica, Himanish. And in 13, I was working with the Cognizant as a team lead. And post that, I have worked for Icon Clinical Research and HCL Technologies. If you see my career chronicle, it is full of learning. I'm always have immense pleasure of sharing my learnings with juniors and brothers like you. Say that it is continuous learning. I have never stopped my learning from past 14 years. After my M.Pharm, I have learned clinical research. I have learned drug safety. I have learned computerized system validation. Out of my passion towards learning new things like blogging and engagement with audience, like giving seminars, webinars. That led me to choose this kind of profile. Everyone were very astonished. Everyone were amazed. Though you are a pharmacy professional, how did you get into these IT companies? That was the first question at that point of time in career in 2008, Himanish. But when I was switching my career also, they were asking me, are you taking any risk? Kiran, you are succeeded well in these companies. You are doing good. Why are you switching your career to education sector or a coaching sector? In coming later questions, I would like to answer you that. This is very brief introduction about me.
Yeah, okay, sir. It's a very good introduction from your side. You're having a good experience in case of pharma sector as well as in pharma IT sector also. Sir, the next question for you is regarding opportunities. Uh, how you will feel like, for example, one of the fresher is coming out from pharma background, like he has completed B Pharm or he has completed M Pharm. For them, means especially for freshers, what suggestions regarding opportunities you will provide, and for experienced candidates what suggestions you will give regarding opportunities.
Definitely, Himanish. That is a right question which you have asked me. At this point of time, to be honest, in 2008 itself, I have done pharmacovigilance. I would ask most of the pharmacy professionals or healthcare IT professionals to choose these kind of careers. During all of my seminars and webinars, I would like to highlight the importance of latest careers. The initial traditional careers was production, QA, QC, analytical R&D, teaching and marketing, and research. R&D was the core professions where pharmacy professionals and students were doing this. To be honest, over a period of time, a lot of pharmacy professionals were starting looking for very good growth, very good opportunities, or very good abroad opportunities. Even for example, during Corona, also a lot of healthcare IT professionals were doing work from home jobs. Everyone want to have their work-life balance. Everyone want to spend time with their families. But these kind of feasibility, these kind of luxury, I can say, is not possible with a core pharma company job or any academics job or a clinician job. That's why we always suggest for freshers, you can choose pharmacovigilance, medical coding, medical writing, clinical data management, business analyst, computerized system validation. And nowadays, we are focusing on Material also, as you know, after pharmacovigilance, material is gaining a lot of importance. And regulatory affairs has one more course, as you know. And medical scribing also is booming nowadays. Just to add to your question, for freshers, we are asking these kind of courses. For experienced, we are there to give them helping hand, because after my pharmacovigilance, I have moved into computerized system validation, as you know. When we met for the first time, I was working in HCL, still doing trainings in parallel, and we were guiding the students right from scratch. You know, the growth of rice trainings also. When we are trying to approach faculties, when we are trying to approach students, along with career launch program, as you said, if you remember, we have done one more video 10 months ago in your energetic dynamite channel.
Yeah, I remember, sir.
Yeah,
10 months back, we did one video in our
exactly.
channel. Yes.
Exactly. In that also, you have tried to explain students there are two programs with us. Yes, the first
Yes,
program
yes.
is
For freshers as well as experienced
exactly,
candidates.
exactly, for launching their careers. You might ask, sir, how shall we launch their careers? Which is suitable careers? Whatever careers are suitable, we are giving based upon their qualifications, their caliber, and their career interests. Along with that, for experience, we are asking them to choose technical courses like RFT, database essentials, database application setups. Suppose if you are into QA/QC, we are asking someone to choose computerized system validation as their upcoming career. As you know, compliance is gaining a lot of importance. There is a huge scope for them, and we should know how these compliance courses are there. And the best part with RISE trainings is students are taking pharmacovigilance course from us. Still, they are able to get jobs in clinical data management, computerized system validation, even in medical writing also. To be honest, at RISE trainings, we are improving their caliber, capacity, and competency levels here. I hope I have answered your question, Hitesh.
Yeah, sir. The next question is actually it's a general question. It is not related to the subject. It's a general question. Actually, you have started your career as a job holder in 2008.
Exactly. Yeah.
Sorry. Hello.
Yeah, Hemish, go ahead.
Hello.
Yeah,
Sir,
Hemish.
actually, you have started your career as a job holder in 2008.
Exactly.
Now you become a job provider person. How you
Yeah,
are
yeah.
feeling? Like nearly two. I'm continually seeing your status and I'm following your websites as well as. I have seen recently, like couple of days back, 275 uh, members they got job from Rice Trainings Group. How you are feeling? Like what is your inner feeling regarding that? And means most of the people will tell, "Sir, we have joined in your coaching center. We got a job." It's very happy to us. That happiness, how you are feeling?
That is always there, Hemish, that say that that positive side of it, it is there. That's where we have written this slogan here. Our battle is with India's biggest problem. As you know, I think the past 3 weeks, there is a trending news in India that we have crossed the population with 145 crore Indian population.
Crore.
But I was always having a feeling that if I am doing job, only my family will get settled now. Okay, my family will be happy. I'll be doing some work from home job. But when I think beyond employment, beyond my job, just like if you are thinking like an philosophical person or person matured, not just thinking self-centric, being only I should be good or my family should be good. Then if you are feeling that I should give a helping hand to my juniors or give a helping hand to upcoming professionals, it's always a risk. At the same time, it's a overwhelming response for me. So we have started it in a tier 2 city like Nellore. We got around 700 plus admissions, which is very huge. 700 plus admissions.
Okay.
And here you can see our placement data. We did not track properly, but we know that it is the 275 plus jobs. Here, if you can see, we are performing consistently, Hemanish. As you said, we are seeing the statuses of each other. We started in 18, but jobs flow started in 2019. In 20 also we got few jobs, and if you see, the number of jobs are increasing year by year, which makes us more responsible. And we always hear a quote that more power comes from more responsibility. If you see our last
Yeah.
year results, it's almost nearly 60 plus jobs. How many? 60 plus jobs.
60 plus. Yeah.
In November
Okay.
and December, eight of our students got jobs. That means per week, two jobs, per week, two jobs. This happened in November and December. That actually increases responsibility and a little pressure to us. But it's always good, Himanish, because only few people will become entrepreneurs, or they will take their own risk, and they don't want to keep their families or their personal life in risk. But I have taken it by doing or having belief only on two things. First thing is, I have believed God and left it to Him. Second thing is, I have
And
believed our,
one more, hard work. Yeah. I know
yeah,
that.
yeah. Second thing is, I believed our students also. I just believed that if I am taking care of their career, they will take care of my family in terms of expenses or whatever it is. If I am working for these students, what will I get back is money I'll get, but at the same time, the basic thing which was missing during my job was motivation and self satisfaction. I was working as a assistant manager, I was working as a drug safety coordinator, I was working as a SME. But the major thing missing during my job was self satisfaction and motivation. And if I say, if I'm working as an employee, I was able to see only my success. But now, if you see, if you count only our placements in the website, it's 140 plus. Okay. I am seeing my success in these 140 plus jobs. Everyone are happy and their families are happy. Yeah, this makes me one of the happiest moment, Himanish.
Yeah, sir, you cleared my question. You have given good answer. And the next question is, sir, for example, the person want to do the job in abroad. For
Okay.
example, he means what type of courses he has to do in case of abroad job opportunities, and he has to collaborate with abroad culture. In case
Okay.
of qualification, what type of courses he has to do? For example, fresher or experienced candidate.
Definitely, Himanish. That's a valid question. Just to add value to your question, I would like to show you our channel also. Uh,
Okay.
what we are trying to do is, we are trying to add value to students' careers by getting industry experts who are there in abroad, who are there in India. We are combining these consultant roles also here. But as you said, if we are planning to go to abroad, we have three options, Himish. The very first option is going through company, which will take you time. This is our YouTube channel. Students can subscribe here, and they can take knowledge from us here. This is our playlist also. Here also we have created some valid suggestions for them. We have conducted one seminar on how to go to abroad, how to plan abroad with one of my junior. Her name is Renuka. We have created one seminar with us, abroad career planning for rice training students or outsiders also. As you said, if they want to go to abroad opportunities, first thing is they need to take some PG or some course here, and they have to work here. They have to work here. If they are working here, definitely it will help them to map their career in abroad also. If suppose, say that one of your junior came to us, they have taken vigilance or medical writing here. With this
Okay.
experience, they can go there and they can map this experience in abroad also. If suppose you have worked in clinical data management in India for 2 years, okay, maybe after 2 years, if you are migrating to Canada, this experience will be counted. Okay, these are all global profiles. You can choose, you can migrate anywhere in India. Sometimes what happens is students knowingly, unknowingly, they will immediately join PG, MS, or whatever it is in abroad. And again, they will call us for courses. Sir, can you give me this course? Can you do this? Like that, they will ask us. And we will give relevant courses to them based upon geographical location. I'll tell you one example. For Germany and Switzerland, for Australia, it is clinical research. Okay. For
Okay.
USA, for UK, it is pharmacovigilance always. For Germany and for Canada also, it is CDM, clinical data management.
Clinical data management. Yes.
Yeah, exactly. It's just like if you are going to Hyderabad, we know that there are IT jobs, there are pharma companies. We have that impression in our mind. In the same way, if some student is going to plan abroad, we are helping them through our consultants and trainers who are present in abroad also. Only thing is they need to trust us. They need to join our consultation process here, and we can help them. We have enough consultants now. We have in USA, we
Okay.
have in Australia also. That's the right question,
Uh,
Himish.
okay, sir. Thank you. The next question is, sir, to collaborate with the foreign opportunities in case of job, how many years we have to work in India regarding in one course? For example, a PV. We want to continue the PV job in case in abroad. For example, US.
Mhm.
In that time, how many years of experience we should have in India?
Definitely, Himanish. Most of my friends and ex-colleagues, they have moved to abroad with two
Minimum
years
experience, I'm
experience,
asking.
minimum
Uh,
2 years experience or 3 years, even or 5 years experience also. But if you are having more
okay.
experience, there are more chances that you are getting job fast there. As you know, they
Okay.
consider more experience there, and they'll ask you to apply with those experience rather than we are applying with less experience, 1 year, 2 years, or like that. You can still apply, but your chances of getting job also will be less. But if you are going for immediately for higher education, say that one of my student or known friend, he have worked in vigilance for hardly 2 years in India. He moved to abroad, but his 2 years of experience has helped him. Okay. So I know some friends and some ex-colleagues who have done 5 years experience, 10 years experience. Then also they migrated. But it's
Oh,
always good to have decent experience on an average, say that 3 years, 5 years, or even 10 years also. But
okay.
experience matters, and it always eases us to do job search in anywhere in abroad also, Himish.
Okay, sir. Coming to the next question, sir. It's like a comparison question. Whether I can ask or not, you tell me. If you are okay, means I will ask.
Okay, okay, go ahead.
No, sir. Actually, in market, so many pharmacovigilance courses institutions are there.
True, true.
I don't know the names, but if I know also, I cannot reveal that now.
Mhm.
Compared to that, what is the different in rice trainings? Means
Okay,
how the people will trust our training institution? Let me explain.
I'll explain you.
Tell me,
Uh,
sir.
yeah, yeah, sure. Thanks, Himanish. To be
Okay, sir.
honest, now the
Actually, sir, the thing is that this question will make more trust on our
exactly,
group.
exactly,
That's why
exactly.
I
Within
asked
within
you.
within your viewers also, I know you have around 1100 plus
Yeah, yeah.
subscription now. If you see this, we are giving the reasons also. Why should you join Rise trainings?
Yeah.
I'll tell you that reasons. First reason is we are not just a training institute, train and ignore the students. We will definitely take care of students for next 1.5 year or 2 years even. If you see this
Okay, sir.
video, they can we can build trust with them. We are outperforming other institutes, or we are doing better like this. You can get trained from 14 years or 15 years of experience like me, and you
Mm,
they will get soft skills. They will get
mm,
database training. They will be equipped with mock interviews. We will give them references, which you know it already. We give references personally. We take care of their resumes, which is most important. Resume preparation, as you know, which is a
preparation. Yeah.
key element to get into jobs, and one-to-one coaching. So we are a training institute. After training, We are helping them to have one-to-one coaching system. We help them with proper academic excellence, mapping their career aspirations with industry expertise, Himnesh. And to
Okay.
check and verify, the best method, what everyone have to do is go to Google and check any institute reviews. That is the only validation process. Go and check their Google reviews. I know there are few institute who will do paid reviews also, who will ask for paid reviews also, who will do it. I'm not asking, I'm not blaming anyone here, but someone have to go and check the reviews part. Our institution is a 4.8 star rating reviewed institute, and there are 3 to 4 kinds of institutes, Humanist. Just to add one more point here, 4 kinds of institutes are there. First institutes are, most of the institutes are nowadays we are seeing getting courses for 500 rupees, 1000 rupees, even 2000 rupees. You can
Yeah,
get
yeah, yeah.
just a certificate from them. It is very clear that they'll not help you with placements and they'll not teach you 30 hours or 40 hours. They'll teach you 5 hours or 10 hours, they'll give you one certificate. That is one kind of institute. Second kind of institute, just like RISE trainings. We say that we are giving training, we are assisting in placements, we are taking care of end-to-end things of your career till you are getting job. There are third kind of
Okay.
institutes who give certificates in mass. They'll take you 2000, 3000, 4000. They'll conduct some workshop kind of thing. And fourth kind of institutes, they clearly say you that we don't take care of your placement. We'll just train you and we
Yeah.
will leave you. They will
Answer.
openly, yeah, hands up as you said. And
Mm.
it is responsibility of each and every student to check who is running this institute, how's their placement rate, and can they take care of my career. Okay, can they take care
Okay,
of
sir.
my career? These 3 questions they have to check. Is this institute is doing good? First question. Second question is, who is running this institute? As a right person. It's just small
Okay,
thing,
okay. Yeah, yeah, yeah.
Himanesh. If you are going to approach any pharmacy college, what we will check? We will check
Yeah, we will check. We will check the reviews as well as the the
whether
person. So means who
yeah,
has studied there, and otherwise principal biography. We will check these things and all. We
exactly.
will
We
go
have
ahead.
to verify, right?
After that, we will
Exactly.
follow that. Mm.
Even I have done it before 22 years. You have done it
Okay.
for BPharm college. We have done it. MPharm college. We have done it. The same thing students also should do for their these kind of IT careers. Then only they will get an idea. Now, you believe me or not, when I started institute in 2016, there were only
Yeah.
60 institutes. How many were there? 60
60.
institutes. Now the
Okay.
number is, believe me it or not, it is 100 plus institutes are there.
Yeah,
They
yeah, yes,
are,
sir.
they are,
Institutions are very high. Mm.
they are. We also are confusing students, but the responsibility of choosing good institute lies with student. It's not
Student.
blindly. They should not go and pay the fee. Suppose if someone should is calling you and saying that for 20,000 I'll give you 6 courses. Other institute will
Mm-hmm.
call you and say that for 20,000 you'll get four courses. It's not about quantity. It's not about quantity. Student have to check the quality of the education, right? They have to take care
Quality.
of
Yeah.
the quality of education, and even if rice trainings also is not performing well, you have to rethink what am I doing. Obviously, the benchmark of any institute is running, getting out good placements, right? If you
Yeah,
see
yeah.
this,
Yes.
even
The
this year
output,
or
everyone will see. Yes, sir. Finally, everyone will
exactly,
see the output only. Mm.
here also, if you
Whether
see, so
they will
so
check
the
the success rate. Yes.
exactly.
Mm.
Yeah. If you see,
Mm.
this year also we got good number of jobs, decent number of jobs. Only
Okay.
9 jobs we got. The best part of this year is 9 jobs in 9 different profiles. Even if you see
Okay.
pharmacovigilance, this is case processing, this is drug safety physician, this is Argus administration. This is 9 are entirely different. That's where we are
Mm.
outstanding from the crowd, Himnish. Most of our
Okay,
students are
sir.
getting jobs. Yeah, yeah. Tell me, Himnish. Go ahead.
Yeah. Okay, sir. It's clear. And coming to the next question, sir, how many types of courses in our coaching center is providing? means how many courses, means like you said pharmacovigilance, CDM, clinical data management, like that, how many courses you from our institution to the
Uh-huh.
public, like students, you are providing?
Exactly, Himnish. Just to answer that question, we have around 17 plus courses, Himnish. Out of
Okay.
them, we are catering only 5 or 6 to freshers. 5 or 6 to
Okay.
freshers. But for experienced, that that bunch of courses are changing. Here is our list of courses which we have
Mm.
roughly. Even in pharmacovigilance, we have a diverse portfolio called pharmacovigilance basic course, advanced course, drug safety physician course. In that also, database setup courses, we have multiple here. That means being an industry professional, being an industry person here, we were trying to address industry needs. Okay. Suppose you are into
Okay.
analytical R&D, you can learn CSV and you can upskill. Okay. That is
Yes, sir.
valid
Okay.
for your career. If suppose
Okay.
there is one girl into regulatory affairs, yesterday we received one call from LinkedIn. She was looking for from regulatory affairs, where should I go? Definitely, it is going to be CSV. For few students, we are giving medical writing. For a few students, we are giving computerized system validation. If you see, most of our courses are as similar as to CROs, like all departments like Paraxel, Icon, PPD, or LabCorp. These are all the
Okay.
departments. If you see, ETMF also is there, and advanced course is there. And recently, one of our
Mm.
doctor also got very good package in drug safety physician. Uh,
Okay.
it's almost 20 plus lakhs. That is the highest package, and we are very proud of that physician. We have launched that
Okay. Okay.
course. We don't want to reveal that
Mm.
his name and his company, where did he got.
Yeah, yeah,
And
that is not good also, sir.
yeah,
Yes.
that confidentiality we
Mm.
will definitely maintain.
Yes,
And
yes. Mm.
best part is we got success in all the 17 profiles. It's not that
Okay.
we just launched it for money's sake.
Mm.
We have
Mm.
launched only for students learning need. If suppose one girl
Okay.
came and asked, "Sir, I want to learn medical writing," we have given. If suppose
Okay.
one guy came and he said that I am in abroad, "Sir, I want to learn CDM, can you give me?" Yes, we have launched. We have launched
Okay.
each and every course whenever student asks. It's not that
Mm.
Rise Trainings launched these courses for money purpose. Money is
Okay.
coming and money will come through us. But first, what we are doing at Rise Trainings is fulfilling the students' needs,
Okay.
learning needs.
Mm.
Once we fulfill the learning needs, their earning will be followed by their learning, obviously.
They're learning. Yes. Okay. Sir,
Yeah.
coming to the next question. Actually, most of the people will think that why we have to go to pharma IT fields. Means like already. Actually, it is my question also, not the public question. It is my question also. For example, if one of the person is working in R&D, like analytical R&D or formulation R&D or production or any other field
Yes,
regarding,
yes,
in
yes.
case of pharma, means core pharma,
Mm.
if he want to change the domain, in case of he want to change to
Mm.
pharma IT careers, whether that means pharma core experience will considered in that case, means in pharma IT career, is it considered? What is the criteria for that?
Definitely, Hemanish. That is a valid question which I am receiving you from industry experts like you, who is
Yeah,
having
yeah, it's
7 years,
any
7
industry to
years.
pharma IT persons. Yes.
Exactly. I came to know this question is a big bit challenging, but we have good answers for it. First thing, let me explain you the benefits. Okay. You'll
Okay.
have this 5 days work a week, work from home options, and these are all progressive careers when compared to pharma companies or clinics. Abroad opportunities can have work life balance. If I
Okay.
say these 5 benefits, definitely you'll be triggered to join these kind of careers. Second thing is, as you said, whether my experience is considered or there or not, means in that also
Yeah,
there
that is
are
the sir.
yeah,
That question is so many members having. because not only me, so many pharma persons, means for example, they are continuing from for example, up to 3 years. If they want to change the domain, they will get easy opportunities, and that experience will be considered as usual. But once the 5 years has completed, means most of the people are thinking that once we have completed in same domain 5 years of experience, it if we are changing the domain from one field to another field, they will
Okay.
think that whether our experience is considered or not, whether we have to again join as a fresher, the salary will be less. Like these questions are highly rising, sir, in all the persons, not only me. For that, what is your answer?
Definitely, Himanish. Considering means there are two things, Himanish. If you want to change domain, or any of your colleagues or if your friends are looking for to change domain, my sincere advice is switch fast. Immediately
Yeah.
switch fast. What happens here is, if you are not switching your domain or profile fast, there your package and your experience grows, and you'll see, or you'll sit in a comfort zone there. That is one
Yeah,
setback
yeah.
for anyone's career, be it academics, be it industry career. If you want to switch fast. Second thing is, considering means there are two choices here. First thing is considering your experience. Say that you are into analytical R&D for 4 years. Yes, I am considering that experience. Still, you can come to healthcare IT careers is one consideration. Second
Hmm.
consideration is considering your existing salary. Considering your
Hmm. Hmm.
existing salary, definitely anyone have to respect your existing salary and experience. Say that if you are getting 6 lakhs of salary, okay, on that next person or next company will negotiate you for 30% hike. 30% hike.
Hmm.
It's up to you. You should go for 10% hike, 20% hike, or 30% hike, or completely leave that package and join as a moderate fresher for 4 lakhs or 5 lakhs package. I'll tell you one classic example. I think 2 years back, one of a student, one of a professional came to us who was having 5 years of industry experience. He was having around 6.5 lakhs package. He left everything there. He completely told me that, sir, I don't want to go to core pharma again. I don't want to go to pharma companies. He completely left his experience package and he came to me and joined a vigilance job for 3.5 lakh. He completely left that. But I am not asking everyone to do that. But sometimes, if it is needed, we have to sacrifice and we have to restart our careers if needed. But I always suggest negotiate with HR in a smart way that you are going to get your package counted. You have to make sure that your package is counted with your existing experience. Say that you are into analytical R&D with 5 lakhs package, and try learning the CSV or compliance or regulatory affairs or medical writing, whatever course suits you or your friends or your colleagues. We need to upskill and we need to start negotiating on your existing package. Never ever have a fear or have an insecure feeling that will they consider my package? Will they consider my
Yeah, yeah.
experience? Leave all the
Hmm.
doubts aside. That is my first suggestion to juniors like you, cadets like
All the
you,
persons. Yeah.
everyone. It's not
All the pharma, yes, all the pharma
exactly very
persons.
very common doubt.
Yeah, yeah.
You can leave
That's right.
all the inhibitions. And one more thing, I think you are in Hyderabad. If you see in
Hmm.
Hyderabad, Amirpeta is having more than 300 plus institutes. Most
Yeah,
of the
yeah, yeah.
institute,
In
most of the
Maitrivanam.
exactly, most of the institutes
Hmm.
are not for freshers. They train experienced people also, because
Okay.
it's a common observation. Any IT BTech person always upskills, where science or pharma graduates doesn't do it. Do you agree or not?
Hmm. Yeah.
I think time is completed, Himnesh.
Yeah. Okay, sir.
Thank you so much.
Finally, thank you, sir. It's very glad to me to interact with you this much time. First of all, I would like to thank you for giving this opportunity, sir. Thank you. We will continue in next session. You have given good advices for pharma peoples, especially me, and like me, so many people are there in market. for them you have given very good suggestions